Hello, welcome to today's podcast on first aid with physiotherapy. My name is Jake Dawes. This podcast is for the Higher Skills module at Bangor University. In this podcast, I'll be focusing on the first aid ABC method. This is airway, breathing and circulation. I will also be discussing how physiotherapy can help with first aid related injuries. First aid is a very important skill to have for many life-saving situations. Today's scenario is a 50-year-old male casualty who is unconscious but is still breathing in a safe environment. The first thing to do in any situation is to check for danger around the local area. This can be fire, electrical or hazardous working environments. In our present scenario, the environment is free from any danger. The second course of action is to check for the casualty's response. Does the casualty respond? Hello? Hello? Can you hear me? Can you hear me? If you can, open your eyes. By gently shaking the shoulder and asking the casualty if they are okay might provoke a response. In this case, the casualty is unresponsive. Next stage would be to check for the airway. To do this, you place two fingers on the casualty's chin, one hand on the forehead, gently rotate the head backwards. Open the mouth, check for any obstructions to the airway. This could be chewing gum, vomit, or anything that's stuck in the airway. In our present scenario, there is no obstructions. Next, we need to check for breathing. Is the casualty breathing okay? Tilt the head back with the two fingers on the chin, as the airway. And place ear and sight down, looking down the casualty's chest. Do this for 10 seconds. Our casualty is breathing, which is great. Next, we need to put the casualty into the recovery position. To do this, as the casualty is on my right hand side, we take near side right hand, put it to 90 degrees. Take the casualty's opposite hand, place the back of the casualty's hand against his cheek. It's important to hold the casualty's hand there, as he is unconscious and he can't voluntarily control his muscle group. Take his opposite leg, bend up towards 90 degrees and roll. The casualty will roll over, making sure to protect the head, very important. Tilt the airway, make sure the airway remains open, and extend this leg to 90 degrees to offer base support so we won't rotate. Next would be dial 999 for an ambulance. The next step is to check for circulation. Is the casualty's skin colour okay? As we can see from our casualty, his skin colour is normal and there is no pooling of blood or blue in any of the extremities of the limbs. If there is any severe bleeding, you must also apply pressure. If there is a foreign object in the body, it's important to place pressure either side of the foreign object. Do not attempt to remove the foreign object. We now need to check for the casualty's pulse. The most easily accessible area is on the carotid artery at the neck. To do this, place two fingers on the casualty's neck and count for 15 seconds using your watch. We now multiply this number by 4 to get the casualty's pulse. The casualty has a pulse of 80 beats per minute. This is normal for resting heart rate. If you have any clothing, such as hoodie, jacket, jumper, or preferably a blanket, now would be the time to place this over the casualty to keep them warm. You should now supervise the casualty until the ambulance arrives. Osteoarthritis is a degenerative degradation of the joints and is most prominent in the knees. Typical symptoms include joint pain, tenderness, stiffness, locking, and sometimes effusion. Hereditary, developmental and metabolic factors may also contribute to the loss of cartilage surrounding bones. When bone surfaces become less well protected by the cartilage, bone may be exposed and damaged. As a result of decreased movement, regional muscle and ligaments have a tendency to waste away. Bone mass or density is lost as people age, especially in women after menopause. The bones lose calcium and other essential minerals for maintenance of strength and function. As a result of this bone density loss, lean body mass also decreases, caused in part by the loss of muscle tissue that surrounds the joint. The rate and extent of changes seems to be genetically determined. Muscle changes often begin in men during their 20s and women in their 40s. Osteoarthritis is a common problem, especially for elderly women. The risk of injury increases because of instability and loss of balance, may lead to falls, as demonstrated in our previous scenario. Some elderly people have reduced reflexes as well. This is most often caused by changes in the muscles and tendons, rather than changes in the nerves. Exercise usually does not aggravate osteoarthritis when performed at levels that do not aggravate pain. Exercise is helpful in osteoarthritis in several ways. First, it strengthens the muscular support around the joints. It also prevents the joints from freezing up and improves and maintains joint mobility. Finally, it helps with weight reduction and promotes endurance and stamina. Applying heat and or cold packs, for example, deep heat products or deep freeze cold spray after exercise can help relieve pain and inflammation. Swimming is particularly suited for patients with osteoarthritis because it allows patients to exercise with minimal impact and stress to the joints. There are various different types of exercises available to patients with osteoarthritis. The hamstring stretch is a great way to alleviate tightness in the hamstrings that is commonly associated with osteoarthritis. To do this, one must stand upright and place the front of the affected leg in front of them. They must then point their toes upwards with a slight bend in their left knee. You should feel a slight stretch in the hamstrings below. You can also choose to support your weight on banisters as well, as this may help you support. Hold the stretch for 20 seconds. Repeat 5 times. The step test is an excellent exercise designed to help patients with difficulty in walking up and down stairs. To do this, place the good leg on a step about 3 inches high. Step up with the good leg slowly, taking 3 to 4 seconds to complete the step. Next, reverse the exercise with the good leg stepping back off the step first in order to reduce the impact and stress on the joints. You can also choose to use a banister as well to help you support yourself. Repeat this exercise 7 times. In order to relieve stress placed on osteoarthritic joints, the inside thigh muscle test is a great way to strengthen the inner thighs. To do this, sit on a chair or a yoga ball and place a pillow between your thighs. Next, tighten your buttocks and squeeze with your inner thigh muscles against the pillow. Hold for 10 seconds. Repeat 5 times. The sit-stand test is designed for patients who struggle to stand up easily. To do this, sit on a chair with your arms folded across your chest, as demonstrated. Next, you'll stand up slowly. Keeping your arms remain folded across your chest, you will sit down again. Repeat this 10 times. All of these exercises have been created to aid patients with osteoarthritis and to relieve pain and discomfort through stretching and joint movement. Over time, the joints shall strengthen and mobility will improve. Other popular exercises include walking, stationary cycling and lightweight training. Physiotherapists can provide support devices such as splints, walking sticks, crutches and walking frames. These devices can be helpful in reducing stress on the joints by supporting the patient's weight. A well-balanced diet with an adequate amount of calcium is important. Women need to be especially careful to get enough calcium and vitamin D as they age, in order to keep their bones strong. The goal of treatment in osteoarthritis is to reduce joint pain and inflammation while improving quality of life. For overweight people, weight loss may be an important factor. Patient education has been shown to be helpful for self-management of osteoarthritis. It decreases pain, improves function, reduces stiffness and fatigue. Patient education can provide on average 20% more pain relief, as knowledge regarding the condition is required and they're managed much more effectively. Non-steroidal anti-inflammatory drugs, also known as NSAIDs, are painkillers which work by reducing inflammation. NSAIDs such as ibuprofen and naproxen will help in reducing inflammation and swelling surrounding the joints. These combinations of treatment options with exercise, diet and lifestyle factors have the potential to sufficiently reduce the effects of osteoarthritis and to improve mobility and function for one's quality of life. Throughout this podcast, I've made every attempt to demonstrate technique by using visual and auditory methods of learning, as stated by Fleming's 2001 model. Thank you for listening.